Okay, you ready?
Go.
Hello, we are here to pick up our girl Nina. How did she do?
Nina did absolutely amazing. We're going to go over some discharge stuff for her if you guys are ready.
Yep, I think we're ready.
Perfect. So for the first 2 weeks, we want Nina to be pretty quiet with a cone on 24/7. No jumping, minimal running and playing. I know this can be tough with a kitten. However, just try your best. She does have a itty bitty incision on her belly. We did take her uterus and her ovaries out, which is typical for a spay. And all of her stitches are internal and will absorb on their own. This is why we want her to be pretty quiet so the incisions have time to heal and the stitches can absorb. The surgery was short and simple, just about 40 minutes long, and we were with her the whole time. Do you have any other questions so far?
Yeah, do we need to bring her back at all? And should we monitor her incision?
Yes, there's no need to bring her back unless you're worried about infection with her incision site. We'd recommend checking the incision a couple times a day to be sure and make sure she's not scratching or licking at it at all. It's completely just normal to see like some redness and swelling, just a small amount. And even something that we call SAS discharge, which is going to be like a light pink clear fluid associated with the healing of the wound. If the incision starts to open up, so you're seeing some of those internal sutures, or it has like a green or yellow, thick, stinky, potentially discharge, or just looks weird, don't hesitate to call us. We do have an email to receive pictures, which we'd really appreciate. And we do have an after-hour phone. So I'm going to give you guys this magnet that has all of our contact information on it, so you have it readily available. And also just don't give her a bath or anything, or soak or anything. The incision can just be the way it is, and the body will just do its job.
Awesome. We are completely new to this, so this is really helpful, but what is that green mark on her tummy?
Oh no, good eye. So I forgot to mention, but she does have a small green tattoo on her tummy. In case she gets out and is found by a stranger, the tattoo will signify that she has been spayed without us having to do anything extra.
How convenient. Will she be in any pain today or for the next few days?
She shouldn't be in any pain at all. We did do some anti-pain injection after the surgery, which will cover her pain relief for the next 24 hours. And then we're sending 2 more doses of that medication home in a pill form to give orally, which we'll show you how to do in a minute or two. And the first one we'll be giving 24 hours after she gets home, and then 48 hours after she gets home. So give one tomorrow and then the next day. There's also, if you're concerned about her, there's an app that we can show you called the Feline Grimace Scale, where you can look at her facial expression and her body language and see if she's painful or not. We use it here, so we can give you a rundown on how it works. And again, if you have any concerns, feel free to just give us a call and we'll work on addressing those. Do you have any other questions or concerns?
What about food? I know we had to fast her for a bit before the surgery, but can she eat? And what about her blood work? Is she healthy?
Great questions. She can eat when she gets home, but just be aware that she may be a little nauseous, or her appetite may be a little less from the next day or so. That's common after surgery. So try giving her about half of what she would normally eat after she eats, and keep an eye on her. After about 30 minutes, if she has not vomited and is not drooling, she can go ahead and have the other half of her food. And tomorrow her meals can return to normal amounts. Every animal reacts differently to the anesthesia we give them, and you know what we're gonna say.
If we're worried, don't hesitate to call.
Absolutely.
Yeah, you got it. And then as far as the blood work and the results of the physical exam goes, she is a perfect little kitten. She is right on track for her age, and then all of her values were within our normal ranges. So Nina is completely vaccinated now for all of the little kitty respiratory diseases along with rabies, and won't need boosters for a while. So we're going to send home with you guys the records, including what she's been vaccinated for and when she's due for those vaccines next. her rabies tag, and then her physical exam notes so you can kind of see what we were seeing, and along with the blood work information, her CBC chemistry that we did, and the discharge instructions.
Awesome. Well, thank you for being so informative. This was super helpful.